My mother was very healthy most of her life. She was driving a car till she was 82. Unfortunately, she developed some cognitive decline. Something happened to my mom, we're not sure exactly what, because she was not verbal at this point, where she seemed to be in a lot of pain. I called Dr. DiFilippo and I wasn't sure exactly what to do, and she says, maybe it's time we include hospice in her care. We need to manage her pain so she's comfortable. That's all we cared about, that she was comfortable.
When we started with the hospice care, they came in, they took care of everything. They helped us set up a specialized bed for him, oxygen, they took care of all the medication. If we needed any medical assistance, we were just to call and they would come. It was a lifesaver.
He was still working up until he almost passed.
So hospice definitely helped us personally, in addition to helping my dad, because it helped relieve some of the time that we had to take to care for him and gave us a little bit of break because we still had to work during the whole time as well as take care of him.
My mother-in-law was clear-minded to the end. She announced to the doctors in front of the family there was to be no endoscopy, no colonoscopy, no surgery. She was 106, that's it. 2 members of the staff at hospice met us at my mother-in-law's home. They were wonderful, and they told us exactly what to expect for the next 24 hours, which was so important for all of us.
Hospice care is a very special part of healthcare. It never focuses on cure. It focuses primarily on comfort.
As medical director, I oversee the care of all the patients on our hospice program. And of course, the plans are already compassionate. But what I try to do is also ensure that they're appropriate and aligned with the patient's and family's needs, and then adjust medication and symptom management as appropriate for each patient.
Once we get into the home, we meet the patient and family, and we sit down and we learn about what the patient's wishes are, what the family's wishes are. And we get to know our patient and families, and we establish a connection and establish trust.
And each week we'll review each patient in depth and try to have a collaborative and multidisciplinary approach and troubleshooting anything that we could do to try to enhance or better the care of these patients.
What's very important to me is people's stories, what their life stories are, to find out what's important to them, what gives their life meaning and value, and how we can infuse this really sacred time with the things that are important to them.
At the end of life, people often, and their families as well, have questions about the meaning of suffering, about the dying process, about an afterlife. These are all questions that I address.
You do not have to have a cancer diagnosis to be on our program or to be on any hospice program. The only thing that is required is that your community physician certify that you have a disease that will shorten your life to the next 6 months.
Hospice a lot of times means the end of the road. That's what people typically think, and that's a hard decision to come by. But I have met many families and wish that they had come on hospice sooner and not waited until the last minute, because there were things that could have been managed at home rather than have the person going in and out of the hospital.
Through the generosity of the Anna and Louis Sheriff Complementary Care Program, we provide music therapy, art therapy, reflexology, and massage therapy.
My role as a reflexologist is to allow the patient some comfort, but mostly it's really about letting the patient know that they still matter through the use of touch. When the families see that their loved ones are feeling more relaxed, more calm, that seems to calm them down as well.
We also have a pediatric program, and that we're there to help the family through what has to be one of the most difficult experiences of their life.
Los servicios que más a mí me han ayudado es porque ella me ha ayudado mucho para que yo pudiera hablar con mi hija y tratar de explicarle todo sobre lo que está pasando con su hermanito. Y también estoy muy agradecida con todos porque todos han estado muy pendientes de mí, de mi familia y de mi niño.
I think caregivers are just extraordinary people, and they are exhausted and they are sacrificing so much because they love their family members, and they often need a lot of emotional support, and we provide that to them as well.
One thing that I find people don't really think about when they're on the hospice program is what comes after. Family members are really focused on the person who's in hospice. They want to take the best care of them. They are trying to, in effect, save that person, even though we know that we all go through this process of dying, and eventually that's going to happen. For many of these people, they don't want to think about that. In the bereavement program, we make sure that we follow up not only with the main family member that's taking care of the patient, but also any siblings, any children, any grandchildren. Sometimes we even work with home health care aides, and this goes on for a long time after the death. And I find that families are surprised that they needed this help, and it helps them to get on the path to integrating their grief and moving forward with their lives.
The volunteer really is the only part of the team who just goes in there. The only thing they need to do is meet the needs of the family, the patient and the family. They don't need to do anything medical. They don't need to gather any information. So they're really just there saying, what can we do? How can I help you, to the family and patient?
With the volunteers, I see how excited they are, how enthusiastic they are about their own program, how good it makes them feel when they go into a home. It's making the end of life much better than it would have been otherwise.
It was definitely a comfort to us. Having that contact was a huge lift to his spirits, as well as care to his body.
Thankfully, I didn't have to do it alone. I had a brother, but even with just the two of us, we had no idea how difficult it would be to take care of an ailing parent, and hospice really, really helped us with that.
I'm in the medical field, and I felt inadequate taking care of a 96-year-old woman with 96-year-old woman problems. My whole family was just so grateful that we had the opportunity to work with Hospice of Westchester. The way they gave the patient the dignity to live out their life, not to push them, and I think that was really important for us as children and for her caregivers to understand what it was like to be at the end of life. We are ever appreciative of having that addition to our care team.